The platisma draws the outer corner of the mouth downwards, thus assisting the depressor anguli oris in this function. It contributes to the formation of wrinkles there too. Here we can see how the platisma is activated when the patient depresses the corners of the mouth. The platisma bands can be palpated along their entire length in order to test their contractile strength. The injection sites are marked at intervals of 1 to 2 centimeters. In order to demonstrate the effects of treating the platisma, patients were treated on one side only. The patient now demonstrates before treatment activation of the mentalis, which has led to her poppy chin. We note that she also activates the platisma at the same time. When she depresses the corners of the mouth, the platisma contraction is very pronounced. In its case, treatment was carried out at the corner of the mouth and chin on her right side, with 15 units of Dysport per injection site. The 2 platisma bands on her right were treated with 5 and 7 injections respectively, with 10 units per site. After treatment, the relaxed face appears generally smoother, and the contour of the chin on her right side is more even. The patient can no longer depress the corner of her mouth on the right, in contrast to the untreated left side. The contrast between before and after treatment is considerable. Her right side is smooth and even, the poppy chin no longer evident. Even the nasolabial fold appears less prominent. When the perioral region and the neck are viewed together, the concerted action of the depressor anguli oris and the platisma is particularly evident. On her untreated left side, the platisma band is visibly contracted and appears as an extension of the corner of the mouth. On the right, the platisma is deactivated and no longer visible. The comparison of the face and neck shows clearly how the contours caused by contraction of the platisma have greatly improved on the right side. Before treatment, the patient demonstrates facial expression in the perioral area. The corners of the mouth droop and there are so-called smoker's lines on the upper lip. When she activates the mentalis while puckering her mouth to blow, the poppy chin and a horizontal line become evident. Both features are exacerbated when she depresses the corners of the mouth. We note the considerable activation of the platisma accompanying this expression. Treatment was thus carried out on the chin and corners of the mouth symmetrically with 10 units of Dysport pro injection site. The platisma, however, was only treated on the right side. The Dysport treatment had a very positive effect on the perioral region of the patient. The corners of the mouth are not completely free of wrinkles, but the appearance is altogether improved, particularly on the right. The relaxation of the orbicularis oris has made the upper lip appear fuller. The comparison before and after treatment demonstrates the change. The chin contour is more even and smoother. When the patient now tries to depress the corners of the mouth, we can see that on the left side there is still some movement, while the right is immobile. The comparison emphasizes the better result on the right side in the area of the corner of the mouth. When the platisma is activated, we can see how contraction of this muscle is responsible for the residual movement of the corner of the mouth on her left. In comparison, the strongly activated platisma bands on both sides before treatment. Interesting to note that despite treatment of the depressor anguli oris on the left, activation of the platisma is able to cause depression of the left corner of the mouth. As a result of the experience gained by treating only one side of the face, I have begun offering patients with marionette lines additional platisma injections. Do you think I should have some Botox in my platisma? Well, if you like, dear, but let me speak to the bank manager about a loan first.